ASF testimony in Parliament on WHO health regulation amendments.
Dear ladies and gentlemen, thank you for the opportunity to testify on this matter on behalf of Australians for Science and Freedom and our colleagues, AMPS. The IHR amendments, like the ill-conceived Australian CDC, on which ASF has also made a submission, ignore the lessons learned from the COVID period, when the centralisation and homogenisation of countermeasures dictated by the WHO and supported by governments were proven failures. I invite you to ask yourself whether the IHR amendments have been proven to deliver cost-effective improvements to the health of the Australian people. Improved health of Australians is the only defensible goal of Australian health policy decision-making. If other goals are guiding Parliament's decisions in this space, this is tantamount to a betrayal of the Australian people. I have never seen a cost-benefit analysis demonstrating that any expansion of the WHO's powers would improve Australians' health, or that it would do so more effectively than other potential health investments. Have you? By concentrating more power and funding for public health in the hands of unelected bureaucrats in Geneva, these amendments undermine Australian sovereignty and weaken the capacity of local initiatives to deliver the best possible health outcomes for Australians in the event of a health emergency. Health is primarily generated locally through things like basic sanitation, clean water, good nutrition, healthy social relationships, adequate sleep, support of individual immunity, and consultation as required with local health professionals, rather than at the international or even national level. It follows logically that health maximization is most effectively achieved by customized local intervention, rather than by international or national mass edicts. Moreover, Australia already has a satisfactory health infrastructure in place to identify and monitor genuine health emergencies. Why then do we need these new rules? Further, the emphasis in the amendments on financing measures for under-resourced countries will result in pressure on Australian taxpayers to fund WHO activities that are not put to a benefit-cost test. There is no recognition of the opportunity cost of such financial decisions. Australia could counterfactually employ these millions in alternative activities targeting health, or make investments in other pressing areas that promote human well-being. These amendments exacerbate the potential for waste, corruption, and abuse of Australian taxpayer funds during emergencies, making mismanagement and misdirection not only more likely, but easier to conceal. An important lesson from the COVID era is that centralized direction of health interventions during a dynamic health crisis, even at the national or subnational levels, let alone the international level, delivers disastrous outcomes. During COVID, we saw this approach give rise to lockdowns, social distancing, school closures, gym closures, closures of houses of worship, deprioritization of diseases far more threatening to human health than COVID, border closures, and supply chain mayhem that drove up prices and encouraged hoarding. The human costs of these disastrous outcomes have been enormous. Not only were Australians' human rights grossly abused during this period, including via institutionalized and systematic censorship of dissenting speech, but basic effective treatments and preventive measures that were not as profitable, such as vitamin D supplements and ivermectin, were deprioritized or even vilified as anti-health. The inevitable conclusion is that what is needed to optimize Australia's health is not further centralization, but rather devolution of power, including during emergencies. Grassroots responses to health emergencies, not top-down mandates, should be the default, supported by holistic, transparent analysis conducted by competent people with no skin in the game, charged with evaluating whether the way Australia is spending its health dollars is delivering real health for Australians in a cost-effective manner. A special note is in order about fear. The amendments create a new pandemic emergency category, more severe than PHEIC. The creation of this category concentrates more power in the WHO and its Director General, using which member states like Australia can be bullied into actions that may be inimical to their own population's health. Elevating the status of any health event to a new and even more panic-inducing level is the very opposite of what should be done by anyone who truly cares about the health and well-being of Australians or other humans. No organization, including the WHO or the Global One Health Initiative that it and the soon-to-be-formalized Australian CDC are part of, can possibly be an all-knowing arbiter of truth and health science, and the idea that supporting such initiatives actually safeguards health is a fantasy. To the contrary, we saw during COVID how the WHO and governments across the West abused their heightened control over health information to bully and traumatize their citizens and restrict communication about effective solutions. Abuse is what concentrated power leads to, and this is why trust in these institutions has declined significantly. Many countries have rejected the recent IHR amendments, including Austria, Brazil, Germany, the Netherlands, Italy, Israel, the Philippines, the Czech Republic, the United States, Canada, and Argentina. We strongly advise that Australia follow in the footsteps of these countries and reject the IHR amendments and maybe exit the WHO to boot. Thank you very much.
Go to scienceandfreedom.org to learn more.